Hi, everybody. Ed Begley Jr. here. Jesus, my first time on here. I must have slept through the pandemic, but hey, at least I finally got my shot. Welcome to Emma Talks, a conversation program pairing experts in all sorts of amazing things related to protecting our planet with the less knowledgeable species of man, most commonly referred to as actors. Emma Talks is brought to you by the Environmental Media Association, an organization I've been part of for so long that being a green activist meant sticking up for Kermit the Frog. So long that I'm recycling old jokes too, okay? Anyway, today I have the great honor of speaking with a doctor, an actual doctor, ladies and gentlemen. Please, a little respect. Dr. J. Lemery, a climate fighter in the front lines of science and medicine. He's a professor of emergency medicine at the University of Colorado School of Medicine, an author and the head of climate science at the University of Colorado. But at Emma, he's our Dr. J. So without further ado, hello, Dr. J. How the hell are you today?
Hey, Ed, awesome. Yeah, great summer day here in Denver, and thanks for having me on. Excited to be here.
I lived in Boulder for a while. I lived in beautiful Boulder there I lived on 9th Street. It was great. Juicy Lucy's was there. The Boulderado Hotel, I think, is still there. The Sink, all those great places in Boulder. It's a great town, but so is Denver. I love Denver as well. Now, you're a doctor. Awesome. Why are you hanging out with them and all of us in the entertainment industry? Tell me why you're doing that.
Yeah, that's a good question. So I met Emma through friends in the industry, and I was on a phone with my buddy, and next thing I know, I was on stage at Emma talking about climate, health, and sustainability with some young Hollywood entrepreneurs. What I really love about Emma is that when I think about we in healthcare, our health messaging on these big issues of climate change and COVID has generally failed. We as a group, suck at this. We've been trained to see patients. We're not necessarily good intuitive communicators. The entertainment industry in Hollywood is, in my opinion, the best storytellers in the world. And Hollywood was influencers before there were influencers, right? So when I think about what we do, we are good at communicating at the bedside. But we're not necessarily great at scaled up communication. So I think in that communication space is our common grounds. And I think with Emma, we have a lot to learn from each other in terms of communicating, risk assessment on these climate and health issues. And, now the issues around infectious disease and the pandemic, which of course are all interrelated.
Yeah, we need to get better at that communication. It's been a real year, that's for sure. I'd love to reflect on what's gone on. Your thoughts on living through a global public health disaster.
Yeah, to use your word real, it's frankly just been a total shit show. We had last year a very disorganized coordination, in federal health care agencies were pulling their punches and letting states decide, and therefore it became very easy to further politicize, our pandemic response as in some ways, right? All of a sudden, the mask became a symbol of freedom over government oppression. Reflecting back on it, I think in some ways it was a real stress test, a big stress test on principles of American citizenship. Our country was founded with mottos like join or die, e pluribus unum, right? And I think collective coordinated action is the only way to beat an infectious disease in our community. I think of the word herd immunity as a great moniker, for the reason that it just really describes what we're talking about, which is if you stray from the herd, the snipers are going to pick you off. And that's what we've been seeing. As of today, we've got like 600,000 American deaths from this in the last 15 months. Places like Africa have 1% of the population vaccinated. So we know the potential for horrid disease spread is still out there. When we further reflect on where we've come as a nation, right? You think about our response in the last year and a half. If that's the way it's been, throughout our recent history, we would still have smallpox in our country. We'd still have polio. So to me, that gives you pause for thought and say, okay, we have got to do better. And really trying to understand, how did we get here?
Are there any silver linings to this? Any opportunities arising from this?
Yeah, I think so. Um, there's a couple things that I think about. I think about sort of the macro and the micro, right? So the macro is that we have seen a historic mobilization, right? We've had a massive economic stimulus packages which were passed rapidly in historically gridlock legislatures. So I think that there was something there that was like, huh, okay, we can actually still function if we need to. We've seen prodigious public sums mobilized for a vaccine. Now, I think the fastest vaccine ever was 4 years in the making. We had the pandemic really hit in March, and I had my shot because I'm a healthcare worker in December, right? So it's 10 months. That is
Amazing.
insanely
It
fast,
is.
right?
It's amazing.
Yeah. I think we also, in terms of silver lining, we've seen the new infrastructure deal. We've seen Biden's ambitious climate plans. We've seen, to some degree, a proof of concept that we can do it, right? We've spent all this money, so we know it can be done. And now I think we have really a once in a generation mandate to reinvigorate our public health governmental operating systems and really focus on the most vulnerable communities, clean energy, and really think about how we can have a more resilient society, moving forward.
I'm
Just
old
on the
enough.
micro part,
Sorry, go
yeah, no,
ahead.
I was going to say, um, and again, this is not so much healthcare, just my own personal thoughts. We've had some soft wins, right? We've seen people moving to parts of the country that they could never live in without Zoom jobs. And I think that's really, really key for our nation because we're seeing an urban, liberal, rural, conservative divide that's hardening. So if we can start to mix that up where, young techies from the city move back to the middle of the country because they have such bomber internet and they can afford a great house. That's a good thing. It kind of is, it's us sort of walking back to each other. Um, just a couple more things I think about is we've reinvigorated our neighborly sensibilities, right? So pandemic, everything slowed down. I started walking around the neighborhood. I was like, oh, hey man, what's going on? Who are you? And you live 2 houses from me. Let's have a
Yeah.
barbecue. And then of course, like things like Netflix, which were, reinvigorated and awesome.
I'm of an age, I remember firsthand stories about World War II, how we all came together. It's tough bringing our partisan government to the table with a common goal. What are your thoughts about a warlike effort promoting climate solutions?
Yeah, I love that question. Are we on a war footing? I think those metaphors probably overused, but helpful. Some say that Roosevelt, right, saw the looming crisis, FDR, in Europe and said he had to wait for Pearl Harbor to happen to mobilize the nation to effectively combat, fascism. So my thought is like, what's our Pearl Harbor? Have we just lived through it? Is it even possible? Is 600,000 dead Americans in 15 months? Is that a Pearl Harbor? Do we need something more dramatic and palpable? It's hard to think about more dramatic than that many deaths, but you think about the attack of the killer heat domes. Is that a thing that will mobilize us? When you think about that era, right, there are some things that still resonate today. And I remember 9/11 going to the Yankee games right afterwards, and they would play God Bless America. I think it was Kate Smith, right? Did you see that? And that would be the seventh inning stretch. And I think that that's something that, reminded us that we can still mobilize great things to meet the challenge. Climate change has always suffered from a lack of risk assessment because it's big, it's blobby, it's insidious. There's no face of evil. At what point will climate change become as scary as, say, the Nazis? I wonder if we're seeing that now, burning down of Paradise, California, or, wild sea level rise and storm surge on the Gulf Coast.
Germany and China recently with all of that flooding and horror.
Totally. Yeah. I mean, so is this enough? Maybe we're just more numb to the news, but I think attitudes are changing across the political spectrum. So to your original question, can Hollywood, as the influencers and the storytellers and the communicators, go on a war footing and, bring people into that modern day Rick's Cafe and say, this is this is a clear danger. It's not going to be easy, but we got to do it. It's time to act. So I never thought that would be possible. I think, I'm generally an optimist, but even people like us get cynical. But I wonder, in 2021, it feels like we're kind of getting there. So a question for you, sort of on that vein. I mean, you've been around for decades in Hollywood. The younger generation is mobilizing, but they're maybe a different species with, social media, and they interact and influence and communicate in a different way. Do you feel like the landscape would lend itself to that war footing? And then sort of my follow-up is like, can we get, I think of who's the conservative person that in Hollywood that we would need, and I think of Charlton Heston, right? Can we get the modern day Charlton Hestons to join in? Because we really, it has to be a culturally bipartisan effort. It can't just sort of be the liberal wing of whatever. So anyway, I don't know what you think about that.
I think it has to be. I think that's a great idea, to get all voices across the political spectrum. I got involved in 1970 because I'd lived 20 years in smoggy LA. And so after 2 decades of that, I said enough. That was the negative influence. And the Cuyahoga River catching fire in '69 was another thing that led to me getting involved in 1970. But the positive influence was my dad. He was a conservative that liked to conserve. We turn off the lights, we turn off the water, we save string, we save tinfoil. He was the son of Irish immigrants. He lived through the Great Depression. So he had that mentality. He never used the word environmentalist, but really he was one. So it has to be bipartisan effort. And we have to remember to celebrate our successes. Even though we have 4 times the cars in LA from 1970, we have a fraction of the smog. It's gotten better, not worse.
But that was old school conservatism, right? Because we have Nixon and the EPA and the Clean Water Act. That was all early 70s. That was a very Republican conservative priority.
We need to get Gary Sinise, then we need to get, Bruce Willis. We need to get those conservative voices among us to talk out, to speak out, to really talk about this with the right scientists and professionals behind us, people like yourselves with degrees in these matters. Just talk about, with Germany now, the flooding we've seen there, in China, and the fires in California and elsewhere throughout the West, and in Australia and everywhere. It's really the time to act, and we have to refute the lie that it's going to cost us. Certainly people earn a living on oil derricks and in refineries and coal mines, but people also earn a living, and a damn fine one, on wind turbines, building them and erecting them and maintaining them, and solar panels and electric cars and energy saving thermostats. Those are jobs of dignity where people aren't dying as they did in the Deepwater Horizon, disaster, or dying in coal mines. People did that same year. The worst energy-related accident I've ever heard about, if somebody didn't bolt the panel on your roof properly, it might bonk you on the head. That's the worst energy-related accident I've ever heard of. So we have to get those conservative voices to do it with us and show us there's prosperity in this too. You can save money if you do it right.
Yeah. Well, I mean, certainly the green jobs, with wind and solar, right in Colorado here on the Eastern Plains. I mean, it's booming. And so that's been a big thing, as to how do we train workers to go there. But the market, right? The market forces are, in some places of the country, renewables are cheaper than traditional oil and gas. So
exactly.
But it's, as that waiting for market forces to sort of make that change is, we just don't have the time.
Can you share what's coming down the pike? There's so much talk about green jobs, infrastructure, equitable communities. What does the climate solution future look like in the medical field?
Yeah, it's a good question. So a few things that here in Denver, it was great because it's a big city. And last year, November election, they passed a climate fund for the city that's now generating 40 million in revenue. So I think we've known this for a while, that cities are really the change agents, because they tend to be a little bit more progressive. The politics tend to be a bit more centrist because they're big urban areas. So cities are able to make change before, states, and certainly federal. So we're focusing on heat, water, air quality within the inner city. And, like I talked about before, thinking about how do we train, vulnerable communities to give them the skills to go into the growth energy sector, right? We're doing projects to lessen the impact of those urban heat islands, right? So cities have all that built environment, they hold heat, much longer than, say, parkland or green space, right? Also things like better transit options where there's less diesel chugging through the community. I mean, there's nothing worse than seeing an 11-year-old come into the emergency department on a hot day because the air quality is so bad that they're breaking through their inhaler and they can't breathe. So I think we're seeing more health impacts being invoked in urban policy. We're seeing healthcare systems themselves think about looking in the mirror and saying, "Hey, we're 18% of the gross domestic product of the nation. The carbon footprint and the waste that's generated in an emergency department it's Yeti-like. It's monstrous. The footprint is huge." So groups like Practice Green Health is an awesome resource for healthcare systems to think about inventorying across many different sectors and keeping understanding the metrics and then being able to make changes and to be able to measure them. And then a final thing in the health sector that we're really starting to think about is how do we stay in a position to help our communities when they get pummeled by extreme weather events or extreme heat or horrible air quality or even wildfires. So, and it's not theoretical, right? Because we have like Bellevue Hospital in New York and Tisch were shut down after Sandy with big storm surge. So the two Bellevue's the safety net hospital for Manhattan, knocked offline for almost a year. Charity in New Orleans, same thing. So hospitals are, when a vulnerable hospital falls offline, it's a double whammy, to a disaster response for a community.
Tell me about the Climate Conservation Corps.
Yeah, this is a cool idea. We wrote about this in the Hill in November, and I love this idea because there's lots of comparisons now between the desperation of the nation and perhaps the new Biden with 1930s and FDR. Whether that's true or not, there's a parallel here with a civilian conservation corps, which was a New Deal project in the 1930s to mobilize American workers to basically invest in the commons, right, of America, where you would give economic opportunity in exchange for national service. And it really espoused that national cohesiveness. What I particularly love about this is that some people have chimed in and said this is it's another big expense. It sounds like socialism, but the data actually says that the two parties are much closer on ideas of national service for Americans than maybe the pundits would suggest. There's a lot of support for that from both sides of the aisle. And when you think about the original Corps in the 1930s, they did things like infrastructure, erosion, flood control, forest protection, ecosystem. Right. Mosquitoes were a big deal when there was no screens or air conditioning. But just extend that to contemporary issues, right? So preparedness training for Oklahoma, flood risk in Georgia, helping Midwest cattle producers anticipate heat stress, building smart gardens to withstand, things that don't need a ton of water, wellness programs for wildland firefighters, a national treasure, right? Certainly this summer. So all those things are aspirational. I don't think we quite know what this thing looks like, but to me, it embodied the spirit of America, and in some ways could help rehabilitate the soul of America. So I think it's an exciting idea. I think there's a lot of health impacts embedded within, and we just have to kind of see how it plays out.
It wasn't just those great products in the 30s and the 40s. During World War II, people got together and they planted victory gardens, to take the paint off the food supply. They gathered rubber and old pots and pans for metal to build tanks. They recycled things so we could build more warships and tanks. People really pitched in at the community level. So I think you have an appetite for that in some circles, and it's something that maybe we could grow, again, using the media responsibly, the way they did with Rosie the Riveter and images like that.
Yeah.
Women involved
right.
in the war effort, and this is another kind of a war. It's a climate war, and we need to fight it intelligently, but we need to engage people, and good messaging is part of that.
Yeah, I mean, we're all in this together. So, it's exciting to talk about this today because it feels like now, 2021 midway is an inflection point that it feels like maybe, the work that we have all been doing in our different sectors, now it's time to sort of come together under a group like Emma, which brings together, obviously it's the entertainment industry, but brings together people from all different sectors like myself. And, think about bringing in those conservative voices. What are clear mission statements? What does a meaningful campaign look like? And again, I think, the precondition is it's got to be able to appeal to both liberal and conservative regions of the nation. So I don't know if you have any final thoughts on that, but, perhaps we could get together at the Emma Impact Summit and do this all over again with more people on stage.
Let's do that and kick around some ideas, but I agree it has to be a bipartisan effort, because that's the way I started with my dad, and that's the way you really get things done. That's the way people got things done in World War II as well, many other times in history. So we got to pull together on this one. And you're a great voice for helping us do that, because we're just actors that learn lines and do our thing. But we have the experts like you out there informing us, people with degrees, people with PhD after the name and other degrees as you hold. It's important to stay close to our experts and use their data responsibly and get the right information out there to people so they know what they can do to help.
Absolutely. Now, and we need to amplify our voices, right? And so I think that this collaboration is all about, is getting a group of us together and leaning on everyone's strengths. And if, we in healthcare have a very important health message to share, you all can help us amplify it and contextualize it and get it to the right people to change the way we think about the world.
We want to. We're standing by to help, and thank you for helping us today and elsewhere. I really appreciate it.
Great. Thanks, Ed. Appreciate that.
Thanks, Jay.